Save the Children International says there is an urgent need for intervention to prevent the spread of cholera outbreak at the IDP camps in Maiduguri due to the recent flood. The flood was one of the worst in over 30 years, which overwhelmed local capacities, destroyed homes, infrastructures and livelihoods, and left tens of thousands of people in their need of immediate humanitarian assistance, including shelter, food, medical care, and clean water. The country director, Takan Avi, said Save the Children International is already on ground in Maiduguri to provide urgent rescue service, life-saving response, and rehabilitation of affected communities.
And we have around 200 staff on the ground, and I'm pleased to report that we were um, able to, from the very first days, to mobilize response efforts in several camps under the coordination of the state government and our National Emergency Management Agency, NEMA and SEMA on the ground. Together with other agencies, Save the Children has been able to scale up our response very quickly. And secondly, to take part in the visit by the humanitarian coordinator to also meet with the state governor in Borno and to, again, talk about how we can coordinate our responses. I guess today's, you will have been receiving all the statistics about the scale of this disaster in the last few weeks, so I really wanted to emphasize some of my own personal reflections about what we're seeing, and particularly the impact of this flood on children themselves. As you know, more than 1 million people across Borno State have been impacted by this flash flood, with a hearing of 400,000 people being displaced. 300,000 of those have ended up in 26 displacement camps, and you saw me reporting on Friday from Bekasi camp, which is one of the largest of those. The conditions there are really tough for children in particular. There's overcrowding, there's a lack of basic services and shelter, and as I said in the video, really food and water is in very much short supply. So we have some really challenging situations for children to deal with on the ground there, despite the very best efforts of everyone to scale up the response. As you can imagine, 300,000 people living in 26 overcrowded camps. As our primary concern at the moment is the short-term needs for food, water, shelter for children and their families living in those situations, as well as supporting children who've been separated from their families. One of the most distressing things that I saw in Bekasi camp was around 20 children who have been separated from their families, we are making our best efforts with other agencies on the ground to try to reunify those children with their family members, to try to identify where their families may have been relocated to.
He said this to journalists in Abuja. He said the first cholera cases have already been reported, describing it as a major health risk that needs urgent intervention.
So you can imagine the situation on the ground. What I saw was overcrowded latrines, a lot of evidence of open defecation where people are having no access to latrines, and therefore, like I say, real risk of disease outbreaks. And we've heard in recent days of the first few cases of acute watery diarrhea and cholera. We are also hearing of the need for, again, to provide bed nets so that we can protect children and their families from the potential for malaria outbreaks. I think the other thing I wanted to emphasize is this is really a crisis upon a crisis. The children in Maiduguri that we have been working with and supporting over the last few years were already in a very vulnerable state in many cases. And again, I'll emphasize, Save the Children has been working in Nigeria since 2001. We've had this operation in Borno State since 2000.